District of Columbia OB/GYN RR, How to Improve Patient Quality and Satisfaction with Sentiment Analysis by Mackenzie Hall and Zachary Maddie.
He had me up sitting on the examining table, and I'm just sitting there, and he looks around, he goes, "You don't know how serious this is, do you?" And I said, "Well, I think I do." And he goes, "No, you don't." He says, "You've got a year to live."
Roger Stump heard those words 4 years ago from the specialist he went to for pancreatic cancer.
And I looked at him, and I said, "I'm going to live from it. I'm going to live through this."
But to do that, Roger had to fire that doctor and search for another.
Health professionals need to be aware of patient satisfaction and dissatisfaction in order to provide quality care. Traditionally, this has been done using standard satisfaction surveys which ask a multitude of questions and take considerable time to complete. The Minute Survey provides a cheaper, easier, and more effective alternative. On only a single page, the patient is asked to answer 2 questions. The first asks whether they are satisfied with their care. The patient checks one of 5 boxes to rate their overall experience. Next, the patient is asked what worked well or needed improvement. This is an open-ended question where they can explain in more detail the specifics of their satisfaction or dissatisfaction. The page contains no information identifying the patient, ensuring anonymity. After completion, the Minute surveys can be used to benchmark against other providers. They can also be analyzed to determine specific areas of interest or concern. This chart displays the top 10 District of Columbia OB/GYNs with the shortest days to next complaint collected from Minute survey data. This presentation will focus on DC OB/GYN, codenamed RR, in order to show the benefits of utilizing a Minute survey and conducting sentiment analysis to help improve quality and patient satisfaction. The data taken from the Minute survey results was analyzed, and the following category results were formulated: number of complaints, daily probability of complaints, days to next complaint, and the physician's average rating. The number of complaints was calculated by looking at the ratings for staff, punctuality, helpfulness, and knowledge. Each of these categories received a rating between 0 and 5, with 5 being perfectly satisfied and 0 being completely unsatisfied. If a rating was greater than 3.5, then the comment would be classified as no, it is not a complaint, and less than 3.5 as yes, it is a complaint. The results for the number of complaints category was 20 complaints out of 26 comments for physician RR. The days to next complaint was calculated by taking 1 minus the daily probability of complaints minus 1. You can see that physician RR has 71 days until they are likely to receive another complaint. Finally, physician RR has received an overall rating of 2.5, which shows room for improvement. The next slide will demonstrate how physician RR compares to other local area DC OB/GYNs for days to next complaint. This chart shows how physician RR, designated by the yellow bar, rates in comparison to other local DC OB/GYNs for days to next complaint. Physician RR rates below the average of 356 days. In this case, to be below the average actually has a negative correlation. Physician RR will most likely receive another complaint in 71 days, which is a quick turnover time, and care patterns need to be improved to increase the days to next complaint. The complaints and praise scores shown in the displayed pie chart indicate that DC OB/GYN RR has 77% complaints compared to 23% praises out of the total complaints collected. In addition to benchmarking, comments gathered through the Minute survey can be analyzed and used to determine causes of dissatisfaction. This is a snapshot of one complaint that was given for physician RR. The comment was collected on January 23, 2008. The comment was determined to be a complaint or praise all adjectives were extracted from the complaint and placed in the column marked adjectives. These adjectives were then classified under one of the following categories: getting in to be seen, other access related, time in waiting room, time in exam room, wait to do the test, wait for test results, etc. This process was carried out for all comments that were given for physician RR. The complaints for DC OBGYN RR were classified into different categories listed on the left side of the complaint classification chart. Certain complaints relate directly with the physician, where others relate to staff, facility, wait time, pay issues, etc. The data for physician RR indicated that a major complaint area was other MD-NP related, at almost 40% of the complaints. The adjectives in the other MD-NP related complaints were analyzed to determine the relative weights for each negative adjective. Displayed is the top 6 complaint adjectives ranked by the relative weight score. Physician RR can use this information to correct caregiving behavior or habits. Cold could mean that physician RR needs to show more compassion to patients. Rushed could give physician RR an indication that more time should be spent with the patient. This process could be continued for all adjectives. Breaking down the adjectives given in the top complaint categories will greatly improve quality and patients' overall satisfaction with care. It will also increase days to next complaint. The proposed method of surveying patients is superior to traditional surveys. First, it is much cheaper than the usual surveys given to patients. The minute survey is a single piece of paper which reduces printing and mailing costs. It is on a standardized form, so it can be applied to a multitude of settings, such as hospitals, clinics, and home health, whether inpatient or outpatient. Response rate is always an issue in surveys, and a larger response is almost always better. Traditional surveys of 20, 30, or more questions leave patients frustrated and more likely to throw them in the waste bin. Minute surveys, on the other hand, can be completed in under a minute. There are less follow-up reminders, leading to reduced costs. More importantly, the new method is effective. Larger surveys often try to ask enough to cover a wide range of patient issues. These are problematic. Too many questions can distort the patient's true views by prompting them for information not relevant to their case. Questions may steer the patient into blaming things they would not have originally thought of themselves. Further, traditional surveys will average good and bad comments. As good comments can often outweigh bad, it becomes harder to notice complaints and the factors underlying them. The new method of sentiment analysis does not have these issues. By only asking 2 questions, the provider is getting what is important: whether the patient is satisfied and the major reason behind it. Because it is open-ended, patients are not steered into answering questions not relevant to them, and background noise is limited. By focusing on complaints and classifying them as seen in this presentation, the new method is able to pinpoint the direct cause of dissatisfaction for patients. In conclusion, the new method of sentiment analysis is easier and more effective overall than traditional surveys. It gives providers the real power to tap into the patient's voice, spot problems, and improve care. This presentation has been part of the Healthcare Information Systems course at Georgetown University.